Hi, I'm Dr. Gary Motykie, and I am a board-certified Beverly Hills plastic surgeon. And today I wanted to talk about a story that's been in the news recently. It's about a 24-year-old female Chinese actress. She's very famous. She's over 5 million followers. And she underwent a open rhinoplasty in China, and she developed necrosis, or death of the skin on her nose.
Gao Liu is a singer and actress who has starred in multiple films and TV programs, and has been seen as something of a rising star. Posting on the popular social media platform Sina Weibo, she explained her months-long absence was due to a cosmetic surgical incident, which has left her with necrosis of the nose, meaning the tissue at its tip has died.
I wanted to talk about this not because I want to scare people, but because I think there's a lot of things to be learned from her story, and then to go over a little bit about the risks and benefits of different types of rhinoplasty procedures. It appears that she had over a 4-hour operation on her nose where they took a part of cartilage, probably most likely from her rib, and placed it in her nose. And they did it with an open technique where you cut across the bottom of the nose, place the grafts in the nose itself. That being a longer surgery and also more invasive surgery, it greatly increases the risk of this happening to her. After the surgery, she noticed that the tip of the nose started turning black, and then slowly, gradually, the skin on the nose just died. In addition to that, she was hospitalized for a couple months. She lost her job, she lost her contracts, she became depressed. It's just an awful nightmare of what you shouldn't do. It's a very rare complication. So again, I don't want to scare people, but I also want to explain why this sort of thing might happen and how to avoid it. So what happened? In the world of surgery, the most important thing for healing is blood supply. So no matter where you make an incision on the body or what type of surgery you're doing, the way the body heals is blood flow. It needs that blood flow for oxygen, nutrition, healing, prevent infection. All of those things come along with blood flow. In this case, in similar cases, what happened is when they did that surgery, they compromised the blood flow, whether they cut through blood vessels in the nose, too much pressure on the nose. Combination of all these things on the nose can cause the tip of the nose to actually die or necrose. So there are different types of rhinoplasty and different ways to perform it, different ways of putting grafts in, incisions, and all of them come with different risks and different benefits. And I think in general, the more invasive a procedure is, sometimes the more risk it has. The two most common techniques for rhinoplasty are open and closed. The reason we use the word open is that in open, the nose is dismantled, the skin is raised, and there's cut through a lot of parts of the nose. And what that does is disturb the blood flow coming up into the columella, into the nose. And if we look at the blood supply to the nose, this is one of the main arteries that supplies blood to the tip of the nose. And then there's some arteries that come up on the side and from down the top. And in the closed technique, there isn't any cut through that blood supply there. And therefore, I think it is a little less risky for tip necrosis. So again, the simplest way I can explain it is that the closed technique, aka scarless rhinoplasty, we're not making a cut across this part of the nose, which can disturb some of the natural blood flow to the tip of the nose. And also when we're looking at the open technique, remember, complete dismantling of the nose. We're coming into the nose, lifting up all the tissue of the nose and doing all the work open, where you can literally see and look at it. Versus the closed or scarless technique, none of that is being done. We're not cutting through there. Everything's being done inside the nose. The skin isn't completely raised up and pulled back. That less invasive nature makes the procedure safer and less risky for things such as tip necrosis. In addition to this, if you can imagine this blood flow, is there's a lot of procedures that add another incision called a wear incision, or incision to reduce the nostrils. So now you can imagine you're increasing risk again. So if you're going to cut through here, and you're going to cut through here, and you're going to cut through here, that again, you can increase that risk to the tip of the nose. So again, I think if you're going to reduce your nostrils, in my mind, it's safer if you do a closed or scarless and don't cut through here, and then it makes these two incisions more safe. Lastly, what we see sometimes is the open technique is people will pack a lot of grafts into the tip of the nose. So they'll raise it up, they'll put cartilage grafts under here. That's going to put pressure on the nose as well as cutting through the blood supply. Now we're really increasing the risk to the blood flow to the tip of the nose. And I think that's some of what happened in this case. She had open technique, grafts put in her nose. And if you can think of those grafts as kind of the blood vessels are trying to come here, and you step on a hose, it's the same thing. The pressure compresses those blood vessels and causes less blood flow to the tip on top of cutting through the blood vessels. So now you can see we're on a slippery slope. And that's when you get into the risk of having necrosis of the tip of the nose. One other caveat I wanted to talk about, because there's a lot of this information going around about the Turkish nose. And I think, although there's probably some really great surgeons doing the Turkish nose, again, I want people to be cautious because a lot of those surgeons are doing the open technique, cutting the columella, cutting the nostrils, and putting grafts in the nose, as well as really thinning the tip of the nose, the skin in the tip of the nose. So all of these things can lead to complications later on, if not necrosis of the tip, can lead to scarring, warping, and deformity of the nose. We've talked about this before, but one thing you watch out for on a side note, people doing these procedures, if their Instagram or social media is only showing results on the table and not long-term results, that's really what's most important. It's not exactly how it looks on the table, but how's it going to look a year later? Because you don't have to live with the nose that's on the table. You have to live with what's going to happen a year later. And so a lot of these patients will fly there, get the surgery, oh, it looks great, fly home, and then things start changing, and then they get really upset. For any procedure you're considering in plastic surgery, because it is elective surgery, well, in any type of surgery, always want to maximize benefit and minimize risk. And so that's why I prefer the closed or scarless technique over the open approach. And I can do pretty much everything you can do in an open rhinoplasty and a closed rhinoplasty. With that open approach, like I said, cutting through here, or cutting through here, adding grafts, putting all this pressure on the tip of the nose, possibly building an even bigger nose, all these things come with risk, and one of those risks is tip necrosis. Unusual, scary, yes, but it is, I think, often preventable. Now, you don't necessarily have to take my word completely for it, so I wanted you to hear somebody else explain it, and that is the doctors from Botched.
Okay. Can you get a hole through your skin again? Yes. Can your skin start turning purple on the table? Yes. The whole tip can turn black and die. I'm worried about. He usually doesn't hear me say this. I'm worried about how your nose is going to turn out. The nasal skin is really thin.
Mm-hmm. He's going to add a lot of tissue, which, you know, he's packing the suitcase, right? Mm-hmm. Puts more pressure on the skin.
Yeah.
You know, you zip up the suitcase, except he's going to put stitches in it. Mm-hmm. You're at super high risk for a blood supply problem. Necrosis, skin death.
Certainly not critiquing or picking on the doctors from Botched, but what I wanted people to realize when watching some of these television shows or social media, that there are other options. Because this technique, the open technique with the grafts and everything, does come with some of that risk, and I want you to hear that out of their own mouths. What I often wonder is, instead of scaring them with all the risk of this open approach and grafts, why not discuss the other options, which would be the closed or scarless technique? And in that technique, the risk would be significantly less. That's my most important point, is that people get informed of their different options and knowing that, oh, this isn't the only way to do this. There are some alternative ways to do this. Why don't I inform you of everything, and then you make the decision that you feel is best for you. One last problem in regards to this sort of a complication, which is, you know, an awful nightmare or you know, death of the tip of the nose, is it's very difficult to fix. So that's a huge reason to avoid this sort of a thing, because once it happens, it becomes a nightmare. You have to wait a long time to fix it, maybe over a year. You have a lot of healing problems, scarring. How are you going to fix the area? You need new skin, new blood flow. So they're talking about flaps and grafts and things to try and rebuild the nose. It just becomes very complicated, very scary, and very expensive. Although it's rare, and I'm not trying to scare you, try to avoid this in the first place. And how do you do that? Again, minimize your risk and maximize the benefit.